Hello and welcome everyone. See, you have a case of 42-year-old man with septic shock who is crashing despite all standard therapies. You have given all your highest antibiotics, sufficient fluid has been given, the patient is on high vasopressors, steroids, still the organs are shutting down. The family is outside hoping for a miracle. What can you do? They are saying you do whatever you want. So now the team decides to try something new, which is called hemoadsorption. So the blood is passed to a high-tech filter aiming to clean it from the deadly toxins and the cytokines which are driving this collapse. But does this bold intervention actually save life, or would it be just making the things more worse? In ICUs across the world, this debate is red hot. Should we believe this hype or stick with what's proven? So let's first understand what is hemoadsorption. Imagine it's a filter that does not just clear the waste, but also grabs your toxins, the cytokines, even some bacteria right out of the blood. It's a miracle device, right? So hemoadsorption devices like the Cytosorb, polymyxin B, and Seraph promise to claim that the cytokine storm in sepsis can be lowered. That is, it can lower the inflammatory chaos and tip the balance in favor of survival. Sounds futuristic, but let's see if it does actually work. So let's first look at the pros. Why some experts are excited about it. Sepsis kills by this overwhelming inflammatory response with lots of cytokines, endotoxins, and cell debris. Studies show survivors of sepsis clear these molecules faster than non-survivors. We have these devices now like the polymyxin B and Cytosorb, which can reduce the cytokines, endotoxins, and even the pathogens in the blood. Some clinical trials and registry data have hinted at benefits in select patients, especially those with very high but not sky high endotoxin levels. Hemoadsorption may reduce the mortality by up to 10%. Mind you, for that you need to measure your endotoxin levels. Certain studies report quicker shock reversal and stabilization, especially if the therapy is started early and is in a very carefully chosen patient. So the idea that is the precision medicine, pick the right patient at the right time and the right filter may benefit the patient. But in the real world, we also have our cons. Let's look at them. Immune responses in sepsis is not really that simple. It's a tug of war actually between the pro and the anti-inflammatory forces battling at the same time. Hemoadsorption removes not just the bad molecules but also some good molecules, including the key immune mediators and even drugs. Multiple large randomized trials like the Euphrates, Abdomix, Compact, Rompa showed little or no survival benefit, and in some cases even a signal towards harm is seen in many of these RCTs, especially if the patient chosen is wrong. Cytosorb, for example, not only failed to improve the survival in multiple meta-analysis, but in some scenarios increase the drug clearance, risking underdosing of the antibiotics. So the current guidelines, they say don't use this routinely outside clinical trials. So what's the bottom line? Do we have hope or it's just an hype? So where does this leave us? Hemoadsorption in sepsis is definitely an exciting concept. The technology works in the lab and in very select group of patients. But in real world, the results are messy, inconsistent, and if you're really honest, sometimes we're definitely worried. But in future, we do have hope. We desperately need something for these type of patients where we have done everything that we have, but the patient is still going down. So we have to track their immune profile, and it must be done in a way which is quick and avoid collateral damage by like the drug removal. Until then, in ICUs, we stick with the evidence-based medicine, that is source control, antibiotics, fluids, and our organ support. Regarding hemoadsorption, we have to still wait. Hemoadsorption as of now is not a game changer for every patient, but maybe with precision medicine and smarter trials, we may get closer. For now, beware of the hype. Follow the evidence, always first, and remember, do no harm. Thank you for your patience.